pepper extract. But the very best thing for the post-herpetic neuralgia, that's after the blisters have cured and the person still has pain. They may have a pigmented area where the blisters were, then you can use the Zostrix in that way, or you can make your own. You can make your own Zostrix by simply making up with a teaspoon of red pepper in a cup of rubbing alcohol. Let it set for a while. When it has turned red, then you can pour up the alcohol part and discard the red pepper part, and put some of that in some kind of cream, something that you may purchase, or just petroleum jelly, or Crisco or something like that can be used, and that you can make up your own. Costs a few cents if you do it that way, and buying the Zostrix will probably cost you, what is it, $25 to $35 in pharmacies nowadays. Okay, let's take conjunctivitis, and I couldn't find a nice picture that I could easily get of conjunctivitis in a child, but it's the same with red conjunctiva, a little bit of pus, which you can see here, and crusting pus up there in that area. And what can you do? Let's see, what's the name of that very serious conjunctivitis that people get overseas, especially in India? I can't call the name of it right now, but it's a very serious form of conjunctivitis. And one of the best treatments for that form of conjunctivitis is simply washing the hands every hour and washing the eyes every hour. And if you do that 16 hours a day, that's 16 treatments a day, you will probably cure most any kind of conjunctivitis. But there are several things that you can do. Ice-cold compresses to the eyes every 2 or 3 minutes for 30 minutes. Then wait an hour and repeat that. That will usually clear up a case of conjunctivitis. But simultaneously, if you're having problems, if it's not a simple case and doesn't respond to one treatment, then you can put heat on the lower part of the face, all across the nose and the lips and chin, and it gives a sort of a revulsive action there. Saline irrigation every 2 hours can also be curative. Herbal compresses at night, and with strong golden seal tea, or with comfrey, or with chamomile, which has mild antimicrobial properties, as well as sedative properties, and a number of other things as well. Cricks in the back or neck, how do you treat that? The treatment of choice, this is the treatment of choice for cricks in the neck and back, are not muscle relaxants, but a hot bath. One hot bath will often be curative, especially if you combine it with the second matter here, and that's a glass full of water or chamomile every 10 minutes for an hour. And most cases of cricks in the neck or cricks in the back will be cured with just such a simple thing. Olive oil with crushed peppermint leaves used to massage the area can be helpful, and just massage with arnica can be helpful. For arnica is, you can make that up yourself as well. It's flowers. You buy the dried arnica flowers from a health food store. If they don't have it, ask them to order it for you because it's readily available. You can also grow it. It's a member of the what's the common little flower we call old maids? No, it grows in gardens, flower gardens all over the South. Marigold. It's in the marigold family, and you can, and the flowers are what is useful there. Okay, cystitis in children, especially involves little boys, but it can involve little girls as well. And hot fomentations, very hot, over the lower abdomen and the upper part of the thighs will often be curative by itself. Do that every 4 hours for 3 days or more, and often that's all that's needed. To drink a lot of water, especially at the first sign. If a child can tell you something, they will often say this, "Mommy, I just had to go to the bathroom a few minutes ago and now I have to go again, and every time I go, it's painful." If the child will tell the mother that with the first symptoms, often she can head it off by simply giving a lot of water, or chamomile, or catnip tea. Those can be used to great advantage. Chickweed can also be used, and so can buku, corn silk, marshmallow, a number of soothing agents for the bladder. And let me mention the next one, and that's a simple diet during the acute phase, and try to find those foods to which the patient is sensitive. An earache. Now, I don't know if you can see my very unclear picture here, but it's an ordinary hypodermic syringe. A 10 cc syringe is good, and you can put whatever it is that you're going to irrigate with, and that will often help an earache, particularly if the earache is due to an otitis externa, where the offending problem is in the canal. That can be very helpful. Heating compress to the throat and to the ear can be helpful. A gargle, a hot gargle, can be good for an earache. How does that work? Well, it's through the eustachian tube, not that you're going to get water up through the eustachian tube or the gargle fluid, but you will treat the ear through the throat, because you get the throat warm or hot with a hot gargle, or with something like golden seal, you will have the astringent action, or the squeezing together of tissue, which can cause the eustachian tube to open up and to drain if draining is necessary, and it may be the thing that's causing the pain. An electric heating pad or hot water bottle to the ear can be very helpful. One time when we were in London in a big crusade there, at the end of the program, Mark Finley's little son came up to me and he said, "Dr. Thrash, I've got the earache." And he was really in misery. So the only thing I had in the hall while his parents were talking with the people who came was a lamp. So I said, "Okay, sit down here in this chair and bend this table lamp over to your ear and hold it there." And he did that, and every time I would walk by there, there was little Finley boy with a bulb as close to his ear as he could get. And I said, "Is it better?" "Yes, it's better." So it does help. Now also it does help to put ice water dropped into the ear from an ice cube. That can be very helpful as well. You might think, "Oh, that would put me in a rigor," but actually it gives the person some nice comfort from that. Warm olive oil can be dropped into the ear with or without charcoal. You can mingle a little charcoal with olive oil. But if you're going to do that treatment, let me caution you, please don't go to a pediatrician after that, because if they look in the ear and they see the charcoal in there, they will think of nothing more after that except that the charcoal is the thing that caused the problem. And you will not be able to convince the doctor that the charcoal was put there to treat the problem, and the earache was there before the charcoal. Hot foot bath or a hot half bath with or without friction to the skin. Now quinsy, the reason that I put that there, not that quinsy is an affliction with the ear, but the pain from quinsy is largely felt in the ear. In most cases of quinsy, that's a peritonsillar abscess. And you can recognize quinsy by the fact that the person does